Discussion went very well. I mean, we dealt with a lot of issues that I came to address from New Brunswick, and the meeting was very cordial and very futuristic planning in terms of what we need to do in New Brunswick and the role that the federal government will play in that.
Some people I've been speaking with in New Brunswick are feeling that you and Prime Minister Trudeau are getting a little bit warmer, a little bit cozier. Why do you need him, and on what topic do you need him to come through?
Well, I think that, it's certainly getting the carbon plan put in place and having not only the consumer model approved in terms of the taxation levels, but also getting the output-based pricing model. So getting that behind us and then our carbon action plan is well defined is important, so we can move on to other issues. We have major issues in the province, softwood lumber certainly being the most notable one. I met with the industry players just before I came here, very concerned. I mean, they've to date spent about $60 million in tariffs. Coupled with that, we have European imports that are coming into the same market without any tariff. And we've had mills closed with others that are on the verge. So it is a crisis for us, and I got every indication that they wanted to get the free trade deal behind them, and the Minister Freeland has said that as well, and then get on with focusing on this, because we have the softwood lumber issue still outstanding both east and west.
I have one more question, if I may, on healthcare. There's a story on Radio-Canada New Brunswick right now talking about French nurses coming to New Brunswick, being told, come here, we have a job for you. They cannot find equivalency for their training. They have to go through the process. The process is complicated. They just quit and they move to Quebec. So what's the problem, and isn't it, how concerned are you given the fact that you need more Francophone healthcare?
I am very concerned, in nurses in all languages really, in terms of being able to provide the service. So we did discuss that, the healthcare, the immigration policy, and the timing in which we can approve the standards. So in terms of how the federal government would play a role in that, I'm very, very focused on helping us move the bar. I've asked our local department in post-secondary education, training, and labor to basically give me a 10 to 15 year plan. I want to know where all the gaps are, whether it be in a hospital, a nursing home, a clinic, where we have these shortages and what we're doing about them in terms of real action, because I want a program that defines each and every year and each and every requirement in either French or English, so that we can just fill the gap. We've seen it already with service delivery models change. We've seen it in the north particularly, where we've had changed the plan practice with our youth center because we just couldn't find people.
Because you're paying for them to come over and then they just move.
Oh, that's not acceptable. We can't continue that, and we will very much deal with that issue.
Did you discuss the abortion clinic?
Yes, we did. It did come up, and I described the accessibility and in relation to our current situation. We talked about the different aspects of the change in what's been happening in relation to the abortion pill. We've seen a big shift from the surgical procedures to the medical procedures now within the province. We do have other hospitals, as we know, in Moncton, 2 hospitals and 1 in Bathurst. And so what we said, we discussed around the Canada Health Act, we discussed around the accessibility, and we agreed that we would resolve this issue going forward about ensuring that we are in full compliance with the Canada Health Act and meeting the accessibility needs that are real.
So does that mean that you'll find a way to keep it open?
What it means is that we'll ensure that we meet what the Prime Minister is looking for in terms of accessibility for all patients, and that's what our goal will be. So it won't be defined specifically in terms right now. Where that ends up, I'm not sure. But the goal is to ensure we have the accessibility that's required in our province.
Also in healthcare, the federal government wants to study what a national dental care plan would look like. What would your government like to see out of something like this?
So we didn't discuss pharmacare per se, or dental care. But we stayed on the healthcare as it exists today. And I guess for me right now, and I know a lot of my colleagues feel that, there's different views amongst us across the country, but we are having trouble right now dealing with the primary care in our hospitals and dealing with both acute care and areas that are traditional as such. New challenges coming into the system with mental health, and I guess we're trying to focus to ensure we have the people and the resources to ensure we keep a system that is whole rate now and level across the country. That was another issue we discussed, about the fact that my concern is that we're going to see disparities from one region to another, from richer provinces and poorer provinces, because they'll have the ability that we won't necessarily have. So we didn't discuss dental care particularly. I mean, I'm always looking to how do we provide better health care for those that don't have an option, and dental care obviously part of that. But I am very focused on meeting the challenges that are facing us right today on the care that we traditionally expect to be provided, and acute care is something that is, we have a wave in New Brunswick. We have a seniors wave coming through our province. We're leading the pack, and Newfoundland and ourselves are kind of in the same vein. Nova Scotia not far behind. But we're going to experience something that other provinces aren't in that aging demographic field. And it's going, that bubble, and you may have seen that chart, but it is very compelling of what we will see in the next 10 to 15 years. And our funding model for healthcare is based on getting through this bubble, getting through this wave. We're going to be doing our part. We changed assessments. We're looking at hospitals and how we can manage better, and because we must. But having a recognition of that across the country, and our discussion today, which the Prime Minister, openly engaged in and openly recognized that New Brunswick has a problem that's a bit unique in the country.
And with regard to the mayor's plan as well, were you told why that hasn't been approved yet? What was the status of that when you spoke?
Well, no, he basically, yes, I did bring that up, and he basically said that would be coming before Cabinet. He's anxious to get it resolved and have the full package behind us. So I guess from our discussions, I would say that early in the new year, we should hear something back. The indications from the departments have been that, we've met the requirements, or at least they don't have any showstoppers, I guess I'll put it that way. We know that the plan is similar to what was previously accepted from another province. So we think it's good to go, and when they get the Cabinet next meeting, maybe it'll be early in the new year. That's kind of the message I got, because he too would like to see our package accepted and moved on.
Premier, what's your assessment? What is your assessment?
On the carbon tax?
Well, we didn't discuss that aspect of it, but for me, it's with my colleagues that we started this and I joined in. It's a jurisdictional question. It becomes that. It becomes a case where we're saying, does the federal government actually have the right to impose this the carbon tax into our region? So we've adopted. We moved on from that, but having that right could affect other issues. What other items could be downloaded because of perceived jurisdictional dominance there or control, and so all this will do is verify what are the limits there, and I think it's valid to do that, and that's why I'm still in.
Premier, what's your assessment of what's happening with the federal Conservative Party and Mr. Scheer's leadership, and where they should go from here?
Well, we didn't discuss that today. In fact, it didn't even come up. So I guess I won't get into that either. It'll work itself out as these political things do. And I'm staying very focused on what we need to do in New Brunswick right now.
Your carbon plan, along with Jason Kenney's, give a bit of a roadmap to the federal Conservatives in terms of drafting their own environment policy going forward. They don't like talking about carbon pricing, carbon plans, but you and Mr. Kenney have both done that.
Well, I think at some point, you get on with the business of the nation, the business of the provinces, and I guess I'd like to say that when the meeting was set up, kind of the emergency meeting set up after the election, it was all provinces coming together quickly. Premier Moe called it, and it was a discussion that I know we'd had collectively, 3 or 4 of us, about would there be a need after the election, and then this kind of separation talk in both ends of the province or country. I was very impressed with the meeting, my colleagues. We all were very focused on we got to pull this nation back together, and I think and from that it came out to a short list of items. But I also said, and I said it in the initial part of the meeting with Prime Minister Trudeau, we saw a very renewed interest on his part to spread it out across the country. Minister Freeland's been traveling, endlessly since taking over her new portfolio. I think the whole demeanor has changed about our country pulling together, and maybe just set them back and say, wow, we have a lot here to be thankful for and to protect. And as leaders in our own provinces, we got a role to play, and I'm seeing that same vision in the Prime Minister's office, that we don't want to get down a trail here and throw away what we cherish in our country of Canada.
Finance Minister ministers are meeting this week. On the table is the fiscal stabilization program. What kind of changes would you like to see to that program, if any?
Well, I did support the removal of the cap because I think, you know, when I think particularly of what's changed in Alberta and the hundreds of thousands of jobs lost and billions of dollars in investment, I mean, if the stabilization fund ever had a criterion, which it's supposedly used for, that would be it, where the economy just drops. We, you know, we had a similar issue back in 2008 with our mills, and we lost several mills. But we were on an equalization formula, so it didn't apply, and that's fine. But I look at certainly what's happened in Saskatchewan and what's happened in Alberta, particularly, and it happened in Newfoundland as well. So there's a need for us to recognize when there's a step change like that. That's what it's there for, and I certainly supported the change to make it happen.
Thank you.
All right, thank you very much. Great, have a good day.